feel like there is enough sort of training and sort of a dispersal of knowledge related to these sort of sensitivities and barriers of certain people in the population? So for you, when you were training as a nurse, were you ever told about this, or is it part of your training?
No, it's not, and I couldn't tell you whether they're looking to do that now. I know that there's been a lot of talk about how do we incorporate a lot of those things in training, but then I'm assuming people probably may not even know. So there's lots of training about respect in different cultures or whatever, but what does that mean? And how do people understand, and how do you translate that within the work that you do? So you often find then it's usually down to individuals who would actually sort of think about it, or may think about how do they do that. So I do think the training that's always been provided about looking at cultural and respecting and biases and everything don't touch on that.
Was it something that you kind of just started observing and then you picked up on it and wanted to sort of be more, because obviously you're quite active in speaking about these issues and stuff, and was this because of just seeing the lack of awareness, I guess, in many of these places?
Yeah, and also too, I think when I first, so for example, when I first started in mental health, people, actually psychiatrists, still had a belief that sometimes if someone was very unwell, it may not always be about mental health illness, there could be something spiritual. You're trained to work in a certain way, so you don't always bring your cultural thinking hat in that. This is the framework I work with, this is how we're assessing you, this is what you need, this is what you should have. So when you get patients complaining, they don't just complain about English people or people European, but they complain a lot also about ethnic minorities in the way that they work or perceive them or judge them. And you find that much more with men who complain, because also you can get stereotypes within culture, sometimes within the way we work and the way people work with patients. So hence the key thing is not just about training, but it's also to ensure there's a lot of reflective practice that takes place, debriefs that takes place within services, because sometimes there's no room for that, but room needs to be created for that, to get people to think about the way they work. And then when patients do complain and make reference to what does that mean, what are they, can people recognize trends, can they see there's something the way we work with them, we need to change the way we work, and sometimes there's not enough of that.
When you're an ethnic minority, it's not only is there the stigma from your own community and your family and coming out and saying you have a mental health problem, and I think this is where I think the sort of Black Lives Matter movement and related things are so interesting, because there's also this, okay, I have a mental health problem, but if I go to this service, are they going to criminalize me? Are they going to just assume something based on my skin color or my culture and my background? And I think that's something that I've always thought of, that I think is such a difficult thing for so many, especially young people as well.
I think that, and just to touch back on what you was asking me earlier on, in terms of how did that happen for me, and for me to be, sort of conscious of that, it took time. It was over time. So I learnt over time through people's experience and just reflect. And I'm a reflector anyway, I've always been. So often I'm always reflecting on my practice. About ethnic minorities, I'm not just talking about Asians and Black. I'm also talking about some Europeans who come from European country, English is not their first language, and have a cultural difference as well, because they get stigmatized too, particularly with being immigrants. And although they may be white, they can get sort of cast into a box as well. You may not have had many ethnic minorities feeling confident to raise concern because they don't want to be perceived as being confrontational or indifferent.
On a more personal level as well, how have your experiences been navigating within mental health as a nurse?
Psychiatrists and therapists saying it who were running courses didn't think we were able to, we didn't have that mind. They will make comments that they didn't think we had that mindset to train as psychotherapists. I remember psychotherapists or CBT therapists, they didn't think we had that mindset. So you often found that, very few of us would be referred to do that course or get on it when applying. And many of us have had to actually, and even including myself, when we've wanted to develop, we've had to pay for our own courses to develop. So the process of achieving and going to where we want to may have been slower. So
whereas other colleagues may not have had to pay to attend those courses,
because we often get perceived as people that are the front nurses, were the strong people were often pushed more into managing aggression and violence than we are pushed into and that may not be always a conscientious thinking, but it happens. Family therapy, a psychotherapy, very much like dominance. Very rare that you will get ethnic minorities because the training is a very long time. And it's a very long time, it's costly, and if it gets paid by the trust, it's who gets picked a lot of the time. Openness, where people are allowed from ethnic minority backgrounds in particular to be able to feel confidently to say, we don't agree with the psychiatrists or other people that are there. We don't agree that this is what the issue is. We think this needs to be considered because of da da da.
After sort of accessing and after sort of people overcome those barriers, I guess the final thing is treatment.
I think medication is a big issue. Most minority groups don't want medication, don't want the treatment. Actually, they are the least compared to European white or westernized white wanting medication. And I think that can be quite cultural specific. You're having to spend a lot of time trying to convince them of that, and that's difficult. That can be quite hard. That's the challenges sometimes, and often, unfortunately, some of them may end up being sectioned as a result to try and provide that treatment. Is also working at the physical health issues, and a lot of that is around how do you help them to eat healthier, manage weight, to minimize weight gain, and also looking at how do you review medication and consider others has less impact on weight gain, if possible. Many people want to be well, but they don't know what well will look like. They've been so unwell for so long. So some of the work that you do, whether you're providing psychotherapy, family therapy, CBT, DBT, whatever, some of that would be around acceptance, rehabilitation work. I would say I see less of minority groups in that situation. Often what you get, a lot more want to be out. They don't. Some sabotaging their well-being to stay in the system because of fear they've become so dependent on you.
Is it kind of this fear of losing the sense of who they are then?
Yeah, because and I sometimes think that maybe it's the way we work with them. That some of our work may be about, it goes back to what I said to you, that I feel that work we do should be encouraging more independence, should be working towards endings, working towards helping them to become much more of their therapist, their own way of coping, helping them being self-sufficient. And I don't know if there's time to do enough of that, but I think it's something that needs to be thought about. Lots of people from different ethnic minorities, you know, that Britain's we have so many different ethnic minorities within Britain, and it's useful if we have everyone, you know, from representing the groups that we work with in mental health. And we'd love to have more people coming into it, and bringing their ideas about how we could improve and work and do things differently as well. So yes, that's all I've got to say.